Hello friends, welcome to Lab Junction. Today we will talk about which color tube we will collect the blood sample for which test. So first of all we will talk about red top tube, which is also called the plain tube. This tube is called plain tube because it does not contain any anticoagulant nor there is any additive. All the serum related tests are performed in this tube. The blood is naturally clot in this tube. So as you have LFT test, KFT test, lipid test, etc. or any test related to immunology or any test related to drugs, you can collect blood sample in this color tube. However, red color tube is very less used in lab instead of this golden top tube, which is also called SST tube. So that is used more than separate serum and perform all the serum related tests. But there are some special tests in which red top tube is also used. But for the rest of the LFT, KFT, thyroid, etc., we use serum separating tube. So red tube is used earlier, now it is very less. Golden top tube is also called SST tube, means serum separated tube. So it does not contain anticoagulant, but it contains clot activator and gel separator. So clot activator clot the blood fast and gel separate. After centrifuging the blood, the serum separates and the cell sits down, and the gel acts as a barrier between them, so that the gel does not mix. For blood collection in this you will get any test related to LFT, KFT, thyroid, repeat parameter. However, if there are some special tests related to drugs, we collect blood sample in the red tube. Light blue top tube is also known as coagulation tube. It contains anticoagulant 3.2% sodium citrate. We collect whole blood in this tube and then separate plasma from it. Then we perform coagulation related tests. For example, if we have to do PTINR test, D-dimer test, etc. The green top tube is also known as the heparin tube. It contains natural anticoagulant heparin. It is made up of lithium heparin, sodium heparin, ammonia heparin. It is mainly made up of sodium heparin. This is for rapid testing. We use it for emergency tests like blood gas analysis, arterial blood gas analysis, etc. The most commonly used in lavender or purple tube, also known as hematological tube. It contains EDTA anticoagulant. In this we collect whole blood. So in the case of hematological tests, CBC, hemogram, RBC, WBC, platelet, HbA1c, ESR, malaria, parasite, etc. So grey top tube is also called as glucose tube. Sodium fluoride is additive in it, which prevent glycolysis, means it prevents glucose from breaking down, and potassium oxalate in it. So if we want to test blood sugar like fasting blood sugar, random blood sugar, postprandial or GTT test or lactate test, for this we collect blood sample in grey color tube. After that, the black top tube is also called the ESR tube. The ESR tube, which contains 3.8% sodium citrate anticoagulant, which is made especially for ESR. Although we do it in EDTA tube for ESR, which is of lavender color, although some labs also have blood in the top of black color. Thank you.